Welcome to Module 2, the 4 moments for hand hygiene. At the end of this module, you should be able to identify, explain, and provide examples of the 4 moments for hand hygiene, and understand the importance of the 4 moments for hand hygiene. Alberta Health Services uses the 4 moments for hand hygiene. During our review, you will be observing healthcare providers during these 4 moments for hand hygiene to collect data on whether or not they perform hand hygiene during patient care activities. The 4 moments for hand hygiene are: Moment 1, before contact with a patient or patient's environment. Moment 2, before a clean or aseptic procedure. Moment 3, after exposure or risk of exposure to blood or bodily fluids. Moment 4, after contact with a patient or patient's environment. For further information, please refer to the hand hygiene policy and procedure on the hand hygiene web pages. Moment 1. Before contact with a patient or patient environment. Performing hand hygiene before contact with a patient or patient's environment prevents the transmission of microorganisms from the healthcare environment, other patient's environments, and/or the healthcare provider to the patient or the patient's environment. Examples of Moment 1 include, but are not limited to, prior to touching the patient or items in their environment, such as bed, bed rails, or bedside table, after touching a curtain or door and before contacting the patient, prior to touching a patient's equipment, such as a wheelchair or walker, prior to shaking hands, prior to taking vital signs, prior to contact with patient monitoring systems, or prior to direct patient contact. Moment 2. Before a clean or aseptic procedure. Performing hand hygiene before a clean or aseptic procedure prevents microorganisms, including the patient's own, from entering the patient's body. It also ensures the integrity of clean and sterile supplies. Examples of Moment 2 include, but are not limited to, prior to preparing food or feeding a patient, prior to handling clean linens, supplies, or PPE, including gloves, prior to starting an IV, prior to taking a blood glucose test, prior to preparing or giving medications, prior to wound care, or prior to moving from a dirty task to a clean task on the same patient. Moment 3. After exposure or risk of exposure to blood or body fluids. Performing hand hygiene after blood or body fluid exposure protects the healthcare provider and the healthcare environment from patient microorganisms. Examples of Moment 3 include, but are not limited to, after contact with saliva or body fluids including urine, feces, or vomit, after contact with linen soiled with blood or bodily fluids, after wound care or dressing changes, after any invasive procedure including intubation or insertion of IV, after suctioning, after opening a drainage system including a catheter bag, or after doffing PPE including gloves used to contact bodily fluids. Moment 4. After contact with a patient or patient's environment. Performing hand hygiene after contact with a patient or patient's environment prevents the patient's microorganisms from being transmitted to the healthcare environment, to another patient, or to the healthcare provider. Examples of Moment 4 include, but are not limited to, after touching the patient or items in their environment, for example, bed, bed rail, over bed table, or the call bell, after assisting with moving or transferring a patient, after shaking hands, after touching a pump, IV pump, or tube feeding pump, after taking vital signs, after helping to position a patient, or after contact with electronic monitoring systems. Please note, these examples only apply if they are the last point of contact the healthcare provider has with the patient during their interaction. For more examples of the 4 moments for hand hygiene, refer to section 3.3 of the Guide to Conduct Hand Hygiene Reviews, located on the hand hygiene web pages, covered in Module 9. You should now be able to identify, explain, and provide examples of the 4 moments for hand hygiene, and understand the importance of the 4 moments for hand hygiene. Congratulations! You've completed Module 2. You are now ready to begin Module 3.